Now, during the primary, the Clintons have pretty much tried to suck up to President Obama, um, basically saying, hey, his policies are our policies, and, well, no, Obama's done such a fantastic job. And let's contrast ourselves against that Bernie Sanders guy who once said, hey, maybe we should primary Obama from the left. Maybe pull him a little bit more progressive, which I actually agree with. I think the problem with progressives is that we don't primary our politicians from the left. No, don't rock the boat. Don't hurt this candidate in a primary, because then they'll have a harder time defeating a Republican. I fucking hate that talking point. It's a ridiculous talking point. It's bullshit. You should primary your politicians if you feel they're not representing you. That's why the primary system's in process, or is part of the process. So now, Bill Clinton has now changed that and decided to make a weird attack against Obamacare. Let's take a look at that. This was at a rally in Flint. So let's take a look at that clip.
But the people that are getting killed in this deal are small business people and individuals who make just a little too much to get any of these subsidies. Why? Because they're not organized, they don't have any bargaining power with insurance companies, and they're getting whacked. So you've got this crazy system where all of a sudden 25 million more people have health care, and then the people are out there busting it sometimes 60 hours a week, wind up with their premiums doubled and their coverage cut in half. It's the craziest thing in the world.
Did he just make an attack on Obamacare from the left? Oh, that's weird. You see, it's kind of funny because there's this entire primary where he could have said that very thing. Now, remember, his wife's running on, well, let's expand on Obamacare just a little bit, but really just kind of keep the same system. Because, single payer will never, ever, ever happen. Ever. But now he says, he comes out and says, we got this crazy system of for-profit heritage care. Not his words, mine, but that's essentially what it is. This crazy system that's set up as a for-profit system that's there to help only insurance companies and not regular people. Yes, it has helped regular people. 25 million more people have insurance, but remember, a lot of these people that might have better insurance can't necessarily afford their deductibles. So there are some serious issues with the Affordable Care Act. Okay? Something that a single-payer system would remedy. Something that his wife ran against. And now he's out there saying this. Of course, he had to walk it back later. But, he mentioned in there, since we're going to talk about the policy of this thing, he mentioned earlier that small businesses, they're getting hit hard with medical costs. Now, that's a problem. You know what could solve that problem? Single-payer healthcare. You take the burden off of the employers to provide healthcare by basically making everybody provide their own healthcare through taxes. Yes, that means your taxes will go up a little bit, but that's money you also save by not having to pay a premium. That's why single payer is popular, because we know it works. It works in every single other country that it's been tried. But we haven't tried it here, so everybody's like, it's not going to work. It's not going to work. How do you know? How do you know? No, it's insurance company salesmen, insurance company lobbyists that are saying, hey, go out and tell the American public that this is not going to work. Why? Because this is going to hurt our profit margins. Comes down to the money. And that's what's wrong with our healthcare system. We are in a for-profit model. Basically meaning, hey, we make money off your healthcare. If you are healthy and you pay into the system, well, that's money that we get. If you're sick, well, we lose money, so we don't want to enroll sick people. Now, the thing about Obamacare is that it made insurance companies have to cover people who had pre-existing conditions that they wouldn't cover before. That was the price, right, for basically getting all of this guaranteed support. Now, unfortunately for some of these insurance companies, well, they weren't making enough profit, like Aetna, who recently dropped out. I did that story. And they dropped out because they weren't making enough money in profit. They lost $200 million on their profit of $800 million or something like that. I think they made like $600 million this past year or quarter. And it's an obscene amount of money. And that's their profit margin. That's not their income. That's not their revenue. That's profit. And they're complaining about losing $200 million. Oh my God, we can't afford it. Obamacare, we got to pull out. Abort, pull out. We got to get out of here. And of course that screws over these people who actually have plans through Aetna. But that's a whole big conversation on what's going wrong with our healthcare system. But the basic point is that a for-profit healthcare system is not a workable solution for a healthcare system. It just isn't. We know. We've tried it. There's a lot of people that aren't happy. There are some people that are happy, but a lot of people aren't. Because it doesn't give that level of coverage that people need. And it doesn't do so as affordably as a single-payer healthcare system would. And that's because, of course, this is a right-wing heritage plan. Now, here's the thing, right? In this election, we've got a couple of different options. Now, we've got Donald Trump and Paul Ryan, the right wing. Basically, all they want to do is tear it down. And then not replace it with anything. Okay, if you want to dismantle it and then replace it with something different, okay, that would make a little bit more sense. And I'm really stretching for these, by the way. It'd make a little bit of sense if you're going to replace it with something like a single-payer Medicare for all. Okay, great. But that's not their plan. Now, progressives, like Jill Stein, Bernie Sanders, well, they want to expand Obamacare to basically have at least a public option. And Jill Stein is, nope, straight up, Medicare for all. And apparently, maybe we could add Bill Clinton to that list. Hey everybody, thanks for watching this video. If you want to see more like this, please hit the subscribe button below. And if you want to support truly independent, non-corporate media, go to our Patreon page and become a patron. Patreon.com/TYTNation.